do you have neck pain? Do you feel your shoulders are weak? And do you think you have a knee problem where you're finding difficulty to climb stairs? Or do you think you walk for 30 minutes and then you feel tired and you're compelled to sit down? Then you may have a musculoskeletal problem. And today we will discuss common issues of joint and muscle disorders which can be effectively treated with a physiotherapy program. Today's physiotherapy sometimes is prolonged, is indeterminate, and can be expensive as well. And sometimes one has to travel distances to see a specialized physiotherapist. Today's episode will largely focus on shoulder and neck problems. The unvarnished truth is that all of neck pain may not have to do with neck, and we will come to deal with that soon in the next few minutes. The shoulder because it is very commonly involved, and the neck because often the neck is a manifestation of shoulder weakness. The shoulder is a challenging problem because it deals with the rotator cuff, and the rotator cuff is the most difficult muscle to strengthen. It is one of the few most ungrateful muscles in the body, and the rotator cuff doesn't get strengthened in a conventional standard physiotherapy program. There are several muscles which are ungrateful and do not recruit or strengthen on exercise, and that is why we must understand that to get the shoulder strong or to get rid of your shoulder pain, you must address the rotator cuff muscle. Unfortunately, it remains neglected. In the same vein, a lot of neck pain is a manifestation of shoulder weakness. Because the neck hurts, everybody directs to the neck and treats the neck because the trapezius muscle is the best muscle to substitute a weak rotator cuff. So often it might be the case where one has a shoulder weakness and the trapezius muscle in the neck compensates the rotator cuff and creates neck pain. Commonly, you may notice that you have pain on overhead activities when you're strained, when you're traveling, when you're doing an extra work on a particular day. In those days, you will have a crick in the neck or you might have pain in the neck. That could be because the rotator cuff is weak. Now, on conventional exercise programs where there's a lot of heat, local therapy, machines, or gym exercises fail to address the rotator cuff because it is a very difficult muscle to strengthen. And if that remains neglected, then one doesn't get enough results. So treatment for neck pain can go on for months and the neck pain never goes away permanently. We aim to solve that with a specialized exercise program. It happens with age, slouching, poor posture, or prolonged sitting occupation. It is not uncommon for the rotator cuff to go weak, especially in the middle ages. Who would need a specialized program for neck pain and shoulder weakness? Now, in the younger age group, if you're an athlete and you find it is difficult to throw and you're finding it that after several attempts at bowling, you're fatiguing, then you need one program. In the middle age, if you're slouching and you find at the end of the day there's a crick in the neck or you're getting weak, tired, and your neck is stiff, then you would need that. Commonly, the housewife or the middle-aged lady will have problems when changing clothes, reaching above the shelf, above the shoulder height, or reaching your back pocket, removing the wallet, and ladies will find trouble tying their bra hooks. These are the first manifestations of shoulder pain. In the elderly patients, if you have serious shoulder pain, disability in reaching overhead or rotating your shoulders, and especially if you have a pain at night, it's a direct hint that you may have shoulder pain. If you have neck pain and your pain is aggravated at night when you sleep, it is probably related to a shoulder problem or a weak rotator cuff. If you have a genuine neck problem, then that never aggravates at night. In fact, the night when you sleep, the neck pain actually resolves. If your neck pain is genuinely emanating from your neck and it is traversing across your elbow down to the hand, then that's a genuine neck pain. You definitely need a neck specialist. This brings us to an interesting situation where I would like to digress and discuss a patient of mine who was a 40-year-old finance executive based in Mumbai, and who had chronic 15 years of neck pain, which eventually led to tennis elbow. Spoiler alert here, that tennis elbow has nothing to do with the elbow. It is because of a weak rotator cuff which has been neglected that leads to a painful elbow. But you must understand that shoulder rehab program also addresses the tennis elbow. He had chronic 15 years pain and came up with neck pain and elbow pain, and nobody recognized that his rotator cuff was weak and deficient. He'd had tons of physio, he'd had short wave diathermy, he had heat modalities, he had steroid injections. Every time he went to a physiotherapist, he got better for a couple of days, but never got cured completely. He was fed up, he gave up his badminton and was almost at the end of his tether. Incidentally, he moved to Pune a few months back and came and saw me, and I checked him up. So I examined his neck, his shoulder and his elbow, and it so transpired that he had an incredibly weak rotator cuff which remained unaddressed. So because he had neck pain, he was treated as cervical spondylosis and fibromyalgia, and that's why he never got better. Now, at 40, he was too young to have cervical spondylosis. If somebody was 60, then cervical spondylosis is a degenerative condition and I can expect them to have cervical spondylosis. But at 40, I don't expect that to happen, and that's why he failed the treatment. So we sat him down and explained to him, because of his job, because of his poor posture, and we said that we will treat you with the PSRP shoulder rehab program, where he is required to come in person half an hour every day for 2 weeks. But at the end of 2 weeks, there has to be a finite improvement, and the improvement should be in pain, in movement and in strength. He was ready, he was clutching at straws, so he came over and did a 2-week program, and lo behold, when he came back in, his neck pain had almost gone, his shoulder was 50% better, and for the first time he was inspired that he is going to get better. So the sum of this was that a clinical assessment was very important to detect the rotator cuff, which can manifest very differently. The rotator cuff is very difficult to rehabilitate because the shoulder is a very challenging joint. Here, what happens is when you're doing a given shoulder exercise or a home program or with a therapist which is unsupervised, then there are a lot of muscles which can compensate for the rotator cuff. So when you're required to use an exercise to train the rotator cuff, it's very common for either the elbow or the neck muscle to come and compensate, and then it will never treat the main problem. So apart from the rotator cuff, all the other muscles get strengthened, and that's why it is difficult to give a result for a shoulder or a neck pain patient. So this gentleman underwent 2 weeks of supervised PSRP, got 50% better, then he was qualified to go on the home program for 4 weeks. He did the home program for 4 weeks, and 6 weeks after we initiated PSRP, he came back and his problem was resolved like magic. At the same time, because of the delay, he also had tennis elbow. You must understand that tennis elbow has nothing to do with elbow. It was because of a compensation of his weak rotator cuff. So at the end of 6 weeks, his tennis elbow also resolved. You must understand that treating elbow in a tennis elbow patient does not move the needle. It has to be understood what is the root problem. So his neck was the victim, his shoulder was the culprit. It is very important, vital and mandated that we must treat the culprit and not the victim. Neck pain can manifest as a result of a shoulder weakness. We have learned that the rotator cuff is a very difficult muscle to strengthen. We have learned that a physiotherapy program has to yield result within a finite period of time. In our hands, a PSRP 2 weeks will tell you for sure that you can improve in 6 weeks time, and that is the most compact and effective rehab program yet. So that brings us to what is PSRP. PSRP is Pune Shoulder Rehab Program. It is a program designed by myself 23 years back and has been practiced for 23 years. It does not involve any modalities, heat therapy, machines. Like it's a pure exercise-based program where the patient is required to come in half an hour every day for 2 weeks. It is an algorithm of exercises which are synchronized in a staggered manner, largely focusing on the scapula, the rotator cuff, and the core. Patients are required to do it for 2 weeks, come back, and in 2 weeks' time, we must ensure that they are at least 50% better, not in pain, but also in function, which means that they should be pain-free, improved range of movement and strength, but not necessarily in the same order. It is very important to focus on the strength. The patients want to redeem themselves of pain. The therapists want to restore their movement as a mark of their effective treatment. But from my point of view, science tells us that you must reinforce the strength. If the strength comes in, the movement and the pain will follow soon after. So that is why the entire emphasis on PSRP has been on rotator cuff and the strength. The best advantage of PSRP does not require any machines or equipment. So once the patient completes his phase 1 2 weeks supervised physiotherapy, they are able to go home and practice that twice a day for 4 weeks, and usually in 6 weeks time they have overcome their problem. Till today, PSRP was done supervised in person at our clinics in Pune. Now that was tough for out-of-town patients who had to come in and do it probably 6 days twice a day. So this brings us to the introduction of Wizio, our artificial intelligence program that allows them to do PSRP in a supervised manner and will monitor, supervise you and mentor you to take you through the PSRP. A major cohort of patients that have shoulder problems are diabetic patients. Almost 1/3 of diabetic patients can present with a frozen shoulder, and that typically occurs 5 to 6 years after they've started their diabetes medication. Once they have a left-sided frozen shoulder, about 5 to 6 years later, they will get an opposite side frozen shoulder inevitably in almost 30% of those patients. When they get a second affliction of the frozen shoulder, the second time is much more intense than the first time, is disabling, very painful, and they come up with a very remarkably stiff shoulder joint. As it is, diabetic patients heal poorly. Any wound will heal with a lot of delay in diabetics, and that is why diabetics take a much longer time to respond to any exercise program. As opposed to your conventional patient who has a decent range of movement, he can exercise better with a better range of movement, strengthen faster. Diabetics have a very stiff rotation, and that's why it will take double the time to strengthen. The magic of PSRP is such that because there's a large emphasis on strengthening of the rotator cuff, the strengthening and restoration of movement happens synchronously, and that's why they will tend to improve their movements and strength progressively, and that by itself will bring down their pain. PSRP is a scientific exercise program that has stood the test of time for 23 long years. It is the success of PSRP that has allowed us to treat a patients with exercises without resorting to painkillers or steroid injections. The Wizio app allows you to do the PSRP exercise program anytime, anywhere, at your home, any time of the day. Calcification of the shoulder or calcific tendinopathy of the rotator cuff is a problem that is becoming very common nowadays. It's a horrendous and the most painful condition of the shoulder. Typically affects women more than men and probably more common in hypothyroid patients. My female patients tell me that the pain is worse than labor pain. It comes like a bolt from the blue, and overnight, till yesterday, patient is normal, and overnight they come up with such excruciating pain that their arm drops down and presents almost like a pseudo paralysis where they are unable to move their shoulder. Typically, a GP would look at the patient and see the remarkable pain and dysfunction and send that patient for an MRI. If it's a small calcification, the MRI will fail to diagnose this, and I get patients very commonly coming in with an MRI with no solution. The simple reason for that is the calcification doesn't show up on an MRI, and that's why a simple X-ray, which is done with a neighborhood radiologist or sometimes a musculoskeletal ultrasound, will correctly diagnose this condition. Because this condition doesn't get diagnosed early, these patients come in late with huge dysfunction, and they have psychological issues because they are spending sleepless nights due to the pain which gets aggravated at night. Once the pain is curtailed, PSRP is a very effective program in restoring the strength, regaining the movement, and taking the pain away for these patients. So why is PSRP so magical? Because it is a pure exercise-based program relying on an elastic band. It does not use any equipment and it restores shoulder biomechanics. The Wizio app brings you the PSRP at your fingertips at your home. All you need is a smartphone, an internet connection, and an exercise band like this. It is sequenced in progressions, and once you reach a certain level, we can always change your band to a higher level, build in progressions, give you a higher level of exercise, or even put you to a phase 3 program. The exercises are sequenced through a finite algorithm and will take you through a sequence of exercises in a specific manner. Initially, you are required to do these exercises using the Wizio app twice a day for the first 2 weeks, followed by once a day for 4 to 6 weeks. Each session lasts for about 30 minutes. If you exercise incorrectly, the app will highlight your mistakes and force you to repeat the exercises correctly. Simply install the Wizio app from your Play Store or your App Store on your smartphone. Buy the band. The app will evaluate your conditions through a series of evaluations and questionnaires and allocate the correct program to you. Once you qualify for the program, the app will give you access to a library of exercises. Using computer vision and the sensors of your phone, we monitor your exercises so that you don't make any mistakes during the exercises. It is possible that you could do similar exercises using YouTube and seeing the exercises, but those are mere replications mirroring another program on YouTube, and it is likely that you will make several mistakes. The Wizio app tracks your movement and posture and guides you like a virtual physiotherapist. It is an intuitive app that not only guides you but also generates insightful reports and charts for your knowledge. It costs less than 1/10 of conventional exercise programs, and this does not also include the cost of lengthy physiotherapy and the inconvenience of travel and the wait that is prolonged. In the next few episodes, we shall cover rotator cuff tears, impingement, neck pain, and many such other conditions, including the knee and the hip. Thank you very much.